Your body isn't falling apart now that you're 40. There's an actual reason why you're feeling pain and weakness and stiffness and instability. And I'm here to tell you that there's a way to start fixing that. And I'll be walking you through that in today's video, so stick around. Hi, I'm Dr. Kristina Turkewitsch, and I'm a corrective care chiropractor in Newmarket, Ontario, Canada. I help women over 40 feel strong in their bodies again by treating the root cause of their disc pain and not just covering it up. In this video, I will be teaching you what degenerative disc disease is and why it's making you feel older than you actually are. So you wake up in the morning and you have stiffness, maybe pain and have a little bit of difficulty getting up. Or you sit down for a few minutes and then you find it difficult to stand back up again. You bend over and everything feels weak and you have difficulty standing up again. You can even be experiencing numbness and tingling in your hands or feet and sciatica going down the back of your legs. And so you just think, well, I'm over 40, right? Like, this is when this all starts to happen. It's all downhill from here. But I'm here to tell you that that just isn't true. That it isn't just all downhill from 40. And there's a reason why you're feeling the way you feel. You don't have to accept that your body is just aging. The truth is that these symptoms are proof that there's something going on underneath the surface. If you have back pain or neck pain or stiffness and pain that worsens over time, like with activities, if you have pain that radiates down the limbs, so down the arms or down the legs, numbness or tingling in the hands or the feet, weakness in the arms or the legs, limited mobility or stiffness, you've lost flexibility that you seem to have had before, or just you've been more flexible in the past and you're losing that and you're wondering why. And this has all really started since you turned 40. You may have disc problems. Disc problems are more commonly known as degenerative disc disease, or DDD for short. And you may have heard, doctors and certain people discussing these terms. Essentially, it's a breakdown of the disc tissue that is in between each of your vertebrae. So as this breaks down, you start to develop more and more symptoms. And essentially, it's early signs of arthritis that are creeping in. But just for today's video, we're just going to discuss it as degenerative disc disease. Now, degenerative disc disease affects 35 to 40% of people by the time they hit 40. And at that point, you just really start to feel it. So this is a problem actually that's been an undercurrent for a really long time, and your body's just been dealing with it until it reaches kind of a breaking point, and then your body starts to exhibit the symptoms. So essentially your body is just unable to cope with the strain anymore. And while it's true that aging plays a factor, it really just breaks down to the fact that the longer you are living, the more chances you have to, have physical injury or trauma to your spine, which will start this degenerative process. When we experience any physical, chemical, or emotional trauma, it directly affects our spine. It has a direct impact on the spine. It puts stress on the body that's difficult to deal with, and this creates misalignments in the joints of the spine. When you're younger, your body can adapt to these stresses more easily. So you may feel momentary pain, but then it subsides, you figure it's healed, and you go on with your life. But essentially, if it's not corrected, then the degenerative process has started. Degenerative disc disease starts before any symptoms are present. And then as we hit 40, our bodies again have difficulty coping. So when these misalignments are present and not corrected, the stresses going through your spine are increased. And so the rate of degeneration starts to increase. And then you'll have the symptoms start to show up. So honestly, the radiographic signs of degeneration can already be there in your early 20s. So what is the difference between just aging and degenerative changes? With just aging, the spine naturally goes through some changes for sure. So for example, your bone density can decrease. We see this, a bit later in life, especially with women, and more often after menopause because the estrogen is gone or the estrogen is seriously reduced. And so the bone health starts to unfortunately deteriorate. So we do see those kinds of changes happen. And over time, the discs of the spine can dehydrate. So as you age, the discs will get thinner and thinner and thinner. because of the dehydration of it. So hydrating yourself regularly and every day is super important to help keep your discs hydrated. However, as the years go on, the disc can become less hydrated. And so these can cause issues in the disc as well. And so these changes are part of a normal aging process. But they usually don't cause pain unless you have a spinal fracture from serious osteopenia and osteoporosis. That can happen. However, as these things are changing just kind of naturally over time, you don't usually feel pain from them. So more advanced degenerative changes, however, can be very different and are usually caused because of some sort of trauma to the spine or the joint itself. So you can get more advanced degeneration in any joint that has undergone a trauma or an injury. Also, repetitive strain can create problems in the joints of the spine or the joints of the body as well. And also there are some various genetic factors that can sometimes play a part. So in terms of the differences in the symptoms, well, with aging, you might have a bit of muscle aches occasionally, right? Joint aches occasionally. But more advanced degenerative changes can cause significant pain, numbness, radiculopathy, tingling, and weakness as well. So then there will be some differences in treatment as well. So as a chiropractor, we kind of treat these things a little bit differently. Now, while it affects a lot of people over 40, women can be more susceptible to developing degenerative disc disease because of a number of different reasons. So the first of which is hormonal changes. It becomes harder for women to maintain muscle mass after 40 because of our hormones reducing over time. So technically around the age of 40, for most people, 35 for some as well, our hormones start to change. Our hormones start to decline. And with that becomes a little bit harder for us to maintain our muscle mass and our bone density. So most people probably won't notice this though until a bit later, so in their 40s. And that's why in their 40s is when you really start to feel these physical differences. And the muscles that really help to stabilize the spine become weaker, which can also make it more difficult on the joints. You're not able to recover as easily. Your tissue isn't able to recover as easily. Your ligaments and joints aren't able to recover as easily. So you feel sore longer. You feel like you injure yourself more often. And so this will increase the rate of degeneration of the joints of the spine. And so again, like I kind of mentioned before, the declining estrogen really makes the stiffness of the ligaments to increase more, stiffness more of the tendons and the joints as well. And then you also reduce your flexibility and your mobility. Now, because of aging as well and maybe some weakness, right? As we get older, a little bit weaker, then for women, the posture changes will start to show. So you'll get more of like a hunch in your back, or you can get more rounded shoulders. These things really start to start to set in, I should say. And so you really want to address these things if you can earlier rather than later, ideally. However, if you do see these changes happening, doing something about them right away is important. So if you see posture changes that were never there before and then just all of a sudden started, you really need to check that out. And again, women become a little bit more susceptible to this. And one big posture change that happens in women is because of pregnancy. And so when you have a baby and then maybe multiple babies, the curvatures in your spine will change because of the heavier load of the baby, and your body's adapting to that, right? But then once you have the baby, those adaptations don't go away. And so then those areas can become weaker and then have problems later. So women will tend to have more low back issues, more sciatica, and more neck pain. So please, whatever you do, do not ignore the early signs. Pain is the final sign, the very last sign that something is wrong. So your body will try and get your attention before this in various ways. So usually posture change is the big one there. So notice how your posture is. If you are already feeling symptoms, then degeneration has already started, and it had started a while ago. So if you're just now starting to feel symptoms, know that the changes probably started at least a decade ago. So I would encourage every 20-year-old to go get your spine checked, because ideally you want to prevent these changes from happening. If you weren't so lucky and you haven't been able, to see a chiropractor early enough, but you are starting to feel these things, definitely get to a chiropractor and get investigated, get an examination and see what's going on, because we still can do something about this. Like, these things can still be helped. We just need you to get in earlier or as soon as possible. So early detection and prevention are the key to dealing with degenerative disc disease. If you are 40 or over 40 and you are feeling any changes like posture changes or weakness in the core, in the back, in the neck, stiffness or tension, increased muscle aches and joint pain, or even more advanced symptoms like sciatica and numbness or tingling, all hope is not lost. You can still be helped, so get checked ASAP. So if you have been told that your back pain is just aging, let me know. So comment me below if that sounds familiar, and I'd love to hear your story. Thank you so much for watching. If you like this video and find it valuable, please give it a thumbs up and consider subscribing so you can get more information about how to strengthen your body and keep it healthy as you age. And please leave a comment if you have any questions. Now, a way to start to end that stiffness and weakness is to start doing a morning stretch routine. In my next video, I'm going to show you the best morning stretch routine to ease disc-related stiffness and pain to help you feel stronger. So check that out next. You can click right here on the screen.